Good morning, everyone. Delighted that you've joined us here at our Health Innovation event. My name is Cindy Yelle, and I have the great privilege of serving as President and CEO of the Toronto Rehab Foundation. And our foundation hosts these breakfast seminars 4 to 5 times a year. And so we cover a lot of topics, and it's our effort, really our interest in educating all of you on some of the work that's taking place, not just here at Toronto Rehab, but right across UHN, and in fact, right across the healthcare system, not just in Toronto and Ontario, but across the country, and in fact, around the world. So I'm just going to take a few minutes to tell you a little bit about how today's event is going to go. But before I get to that, I'd like to acknowledge the chair of our board and the sponsor of all of these breakfast events, these breakfast innovation seminars, and it's Bob Blakely. Bob, can you raise your hand? Bob has been chair of the board now for around 2 years, just about 2 years. He's ending his term in June of this year. He's been on the foundation board as a director for...
Emergency power test has now been completed. Thank you for your cooperation.
You're welcome. So Bob has been a director on the board for the past 7 or 8 years. I think you arrived just before I took on this role about 7 years ago. And during his tenure as chair of the board, we have nearly completed the country's largest ever, Canada's largest ever campaign for rehabilitation, a $100 million campaign. We're at about 98. So we're inching up towards the total. And really, thanks to Bob and all the directors on the board, has really transformed our foundation. And really, it's for the benefit of advancing research and clinical care here at Toronto Rehab. So thank you again, Bob. A privilege to work with you. Today's session is entitled The Silver Tsunami. And the reality is, and we've known this for decades, is that this baby boom generation, which I just missed actually, I'm just on the tail end of it, has created great opportunities in Canada, but there are some challenges currently facing us, and they're going to become more dramatic as this bubble goes through the system. In fact, by 2030, so not that many years down the road, the entire boom generation will have reached 65. And in fact, 1 in 4 Canadians will be senior citizens, if you consider 65 senior citizens. And that's going to have an impact on our economy, an impact on society as a whole, and certainly an impact on healthcare. And so this is what we're addressing today. We're going to hear some stats from an expert from one of the world's leading insurance and actuarial companies. This is Sun Life Financial. We're going to hear from an individual that has a health system perspective and has had a leadership role in healthcare, but also a role with the government as well. And then you're going to hear about some really unique and innovative technologies that have been homegrown here and led by Dr. Jeff Fernie, who I will introduce in a moment. I want to let you know that I've recently come back from holiday. I was in Costa Rica 2 weeks ago for a week. It is the most delightful place I have ever been to. The interesting thing about Costa Rica, and I'm not sure if anyone of our panelists are going to speak to this, but it's considered a blue zone. Does anyone know what a blue zone is? What's a blue zone?
A blue zone is an area of the world where they have a disproportionate amount of centurions within their village, town, or area, geographic area.
Perfect. So they have a disproportionate number, a percentage of their population that actually reaches 100 years of age. And there are about 5 or 6 of these blue zones in the world. Costa Rica is one, Sardinia is another. There's a village in Japan that's also home to one of these blue zones. And you start to wonder when you're there, you know, what is it in these communities that kind of enables these individuals to live these extraordinarily long and fulfilling lives? Is it the diet? Is it the fact that it's the environment, the weather? Is it the fact that they're outside exercising, or is it the fact that they have these communities that embrace the members, not just the young, but the kind of the middle-aged and the older and wiser ones? And so it's an interesting thing to consider. So Blue Zone, if you haven't been to Costa Rica, I highly recommend it. It was spectacular. So our first speaker, and I'm going to introduce them all, and then I will pass the mic. First speaker, and I have to go to my notes so I get your title right, is Wayne Miller. Wayne, if you'd like to stand up. Wayne, I'm going to do this from memory. Wayne is the Vice President of Group Benefits at Sun Life Financial. You've had a career, I believe, spanning 3 decades in a variety of leadership roles, and you're going to speak to some of the demographic trends and statistics surrounding our population, surrounding our community, which is fantastic. Thank you for being here. We also have Dr. Samir Sinha. Samir, if you could stand, please. Samir is the Director of Geriatrics here at UHN and also at Sinai Health. You were a Rhodes Scholar. I believe you're affiliated with Johns Hopkins as well as a professor. You're affiliated as a professor with the University of Toronto. I saw your CV. It's like 20 pages long. Very impressive. In 2012, the province of Ontario, Ministry of Health, recruited Samir to lead the senior strategy for Ontario. So we're very fortunate to have Dr. Sinha here talking about a system-wide perspective on our aging population. And finally, last but definitely not least, is what I would say a rock star scientist. And I don't know if he likes me referring to him that way, but it's my esteemed colleague, Dr. Jeff Fernie. Jeff, if you could stand up for a moment. Jeff really was the architect of research enterprise here at Toronto Rehab, had been just stepped down actually as director of research in January of this year. But it was his brainchild. It was his foresight to develop capacity, to develop facilities, to recruit extraordinary young scientists to come work here and engage in research at Toronto Rehab. Recently, not so recently now, I suppose, about 2.5, 3 years ago, under Jeff's leadership, Toronto Rehab's research enterprise became recognized as the world's leader, the #1 foremost research center focused on rehabilitation in the world. And so I say this line a lot, but there aren't many organizations, public or private, in Toronto, in Canada, in fact, that can claim #1 status. But thanks to Jeff and colleagues across our institution right here at Toronto Rehab, we can.